Welcome to this educational program. This module provides information about the prostate gland, a related blood test called PSA, and prostate biopsy. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. This material is independently produced. You are welcome to view this presentation as many times as you like. Furthermore, you may pause the presentation or skip through parts of it using the player on your left. You may view the slides in any order you wish. Prostate biopsy is a common and simple outpatient procedure which your doctor has recommended for you. This presentation will provide some simple background information about the prostate and its evaluation, then give details about the biopsy procedure. Resources and references are listed in case you would like to research the topic further, and other modules are available discussing other prostate conditions in more detail. After your biopsy, you may also view another presentation which discusses prostate biopsy results. The prostate is a chestnut-sized gland situated at the bottom of the urinary bladder, the place where urine is stored. It surrounds a portion of the urethra, the tube that carries urine from the bladder out through the penis. The prostate gland secretes a thin, milky fluid that nourishes and helps activate sperm cells. There are three common conditions that can affect the prostate: non-cancerous enlargement of the prostate, called benign prostatic hyperplasia, or BPH, inflammation of the prostate, called prostatitis, and prostate cancer. These conditions are reviewed in detail in other modules. Prostate conditions are diagnosed initially by a careful medical interview, including specific questions about urinary function. A physical examination, including the digital rectal examination, or DRE, and lab tests, including urinalysis and the PSA blood test, may also be performed. The digital rectal exam is an important way to assess the prostate. The prostate gland sits next to the rectum, and by passing a finger into the rectum, a doctor can feel one surface of the prostate. He or she can roughly assess its size and consistency, and can also evaluate for tenderness in the prostate and for the presence of prostate lumps, or nodules. Most prostate cancer begins in the outer part of the prostate, so if a lump of prostate cancer has formed, it can be felt on an exam. The DRE is an easy and inexpensive way to screen for prostate cancer. The downsides of the DRE include minor patient discomfort, difficulty evaluating the prostate in obese men, and the fact that experience is required to identify the subtle differences in how a prostate feels. Furthermore, many men with an abnormal DRE do not turn out to have prostate cancer, and most men with early cancer do not have an obvious lump. PSA is a protein made by the prostate and released into seminal fluid and into the bloodstream. The test used to detect PSA in the blood is very accurate, and PSA therefore provides an excellent marker to measure the activity of the prostate gland. So what is a normal PSA value? PSA is measured in lab units called nanograms per milliliter. Many doctors use a strict upper limit of 4 nanograms per milliliter for all men having their PSA tested. In other words, your PSA should be less than 4. Studies have shown, however, that because most men's prostates grow larger with age, their expected normal value for PSA increases with age. This table lists the normal ranges for PSA by age and race, and many doctors have adopted these values as their cutoff values. As an example, if you are a 55-year-old white male, your PSA should be less than 3.5. Note that there is no normal PSA specified for men beyond 79 years old. Many men would like to know what the chances are that they have prostate cancer if their DRE or PSA are abnormal. Statistically, as you can see on this chart, there is still a greater chance that you will not have cancer even with an abnormal DRE or PSA. However, every individual's situation is different. It is also important to point out that prostate cancer can exist with a normal DRE or PSA. In fact, 70% of men diagnosed with prostate cancer today have a normal DRE. If your DRE or PSA is abnormal, your doctor will discuss the findings with you. you may be asked further about urinary or other symptoms to rule out obvious causes of the findings. Often, a urine test is done to rule out infection or other conditions, and the PSA may be repeated to confirm the result. At some point, you will likely be referred to a urologist, which is a surgeon specializing in the genitourinary tract. The interview and exam will be repeated, and if felt necessary, a biopsy of the prostate will be requested. The prostate biopsy is a simple procedure used to get samples of prostate tissue to look at or analyze under a microscope. It provides the best way of knowing if an abnormal DRE or PSA result is due to prostate cancer or not. It is a quick, outpatient procedure, meaning that you do not need to stay in the hospital overnight. Prostate biopsies are required when there is an abnormality of the prostate felt on DRE, when the PSA is elevated, or when previous biopsy has shown abnormal cells which require further clarification. Most doctors will recommend a biopsy in men with a PSA above the age-adjusted values discussed previously, while others will use a strict cutoff of 4 for all men. The process of a prostate biopsy usually involves 2 or 3 stages. In many centers, an ultrasound of the kidneys and bladder may be done first. You will then be positioned on your side and the prostate will be scanned and measured. Finally, biopsy samples of the prostate are then taken. Ultrasound uses high-frequency sound waves to produce images of the inside of one's body, just like sonar on a ship or a fish finder when fishing. For an abdominal ultrasound, a device called a transducer is moved across the abdomen to show a picture of its contents. In particular, the kidneys and bladder are evaluated closely. The prostate can be evaluated somewhat during an abdominal ultrasound. However, the best way to get an accurate view of the prostate is to scan it through the rectum. This is called a transrectal ultrasound. To do this, a narrow ultrasound probe is passed into the rectum a short distance and used to visualize the prostate, as shown here. This feels like having a DRE. The prostate is measured, and any abnormalities of the prostate are noted. In most cases, ultrasound does not usually see any abnormalities suggesting cancer. It directs where the sampling needle goes. Once the prostate has been examined, biopsy samples are taken by attaching a special device onto the ultrasound probe, which has a spring-loaded needle fixed to it. This needle is accurately directed toward the prostate, and by firing the spring, the needle shoots forward and takes a small sample of prostate tissue. When the needle is triggered, you will hear a sharp snapping sound. The number of samples taken will vary from center to center. Typically 10 or 12 biopsies are taken. In preparing for the prostate biopsy, eat a normal meal the night before and a light breakfast the morning of the procedure. Avoid blood thinners for 1 week before the procedure, which includes drugs such as Coumadin or warfarin, Plavix, Ticlid, and full-strength aspirin. Low-dose or baby aspirin may be okay, but this should be reviewed with your doctor. You will have been given a prescription for an antibiotic to prevent infection or some samples to take. It is extremely important that you take these medications as prescribed by your doctor. Please have a ride home arranged, as you may not feel well enough to do so on your own after the biopsy. It is normal to be a bit anxious about the prostate biopsy procedure. Some men have heard stories from friends and family, and others let their imagination run wild prior to the test. Our goal in having you view this presentation is that you will be more informed about the procedure, lessening some of the concerns you may have. Many men are concerned less about the biopsy itself and more with what the results might show. Remember, however, that more biopsies turn out to be negative than positive, and just because you are being sent for a biopsy does not necessarily mean that you have prostate cancer. When you arrive for the biopsy, you will likely be asked to change into a gown. Then you will lie down on the examining table. In some centers, you may be given an enema to cleanse the rectum prior to the procedure. As mentioned, in some centers, a kidney and bladder ultrasound will first be performed. You will then lie on your side, and a rectal examination will be carried out. Not all centers use local freezing techniques, but most do. There are several ways of providing this freezing, ranging from enemas to injections around the rectum or anus from the outside, to injections through the ultrasound probe. Some centers also give sedative medication. Most commonly used are injections through the ultrasound probe into the nerves around the prostate, similar to how your mouth is frozen in the dentist's office. Your doctor will discuss this with you in more detail. Once freezing is given, the ultrasound probe is passed into the rectum and the prostate is scanned. As noted, the prostate is measured and any abnormalities are evaluated. The biopsy device is then attached to the probe and the samples are taken. It is the exception to the rule when abnormal areas are visualized in the prostate. In these cases, so-called focused biopsies may be taken from that specific area. In all cases, regardless of whether or not abnormal areas are seen, a series of random biopsies will be taken to ensure that all areas of the prostate are sampled. Taking more biopsies improves the accuracy of the procedure in diagnosing prostate cancer, and most centers will take 10 to 12 samples. Many men are concerned that a prostate biopsy will be very painful, and they have anxiety related to the route of penetration through the anus, the fact that their sexual organs are being examined, the use of needles, and the possibility of cancer. In reality, more men describe the procedure as simply uncomfortable or unnatural than actually painful. The degree of discomfort felt during a prostate biopsy will vary from patient to patient, depending on their level of anxiety, the number of biopsy samples taken, and the anesthetic technique used. Finally, you will be taken to an area to be observed for a short while before being discharged home. Some men may feel lightheaded afterwards, and this is natural. Again, it is important to have a ride home arranged, and once you arrive home, you should rest for several hours. After your biopsy, the prostate tissue samples will be sent to the lab to be processed and examined by a pathologist. The pathologist will look at the tissue samples under a microscope and send out a report to your urologist. It will often take a week or two for your doctor to receive this report, and you should have a plan to meet with or talk to him or her once it is available. After a prostate biopsy, it is normal to see some blood on the stools or in the urine for a short time. Drinking plenty of fluid and resting for a couple days will help allow this to settle. It is also normal to see some blood in the semen or ejaculate for several days or even weeks. The blood may appear as rust-colored spots in the ejaculate. Please note that during this time, it is safe to have sexual relations, as it is simply blood staining. There is no risk of transferring cancer to your partner. Prostate biopsies are generally safe. Discomfort and the possibility of lightheadedness or fainting has been discussed previously. The most important risk to understand is that of infection, which may range from mild to severe. It is for this reason that you must take your antibiotics as prescribed by your doctor, beginning before the biopsy is done. Even with antibiotics, infections can rarely occur with bacteria that are not sensitive to the effect of the particular antibiotic you have taken. Be careful to watch for signs of infection and report them to your doctor. About half the men undergoing biopsy have some blood in the urine afterwards, and many also have blood in the ejaculate, as discussed previously. Bleeding through the rectum is usually mild and short-lived. However, the occasional man will have more significant bleeding. You will be observed after the biopsy to be sure that this is not the case. If you have concerns about this, contact your doctor. Finally, many men are concerned that having a biopsy might cause or speed the spread of cancer. It is important to understand that this is absolutely not the case and should not be a concern for you. Call your doctor if you develop any of the following after your prostate biopsy: a high fever, chills and shakes, persistent significant burning with urination, or significant problems emptying your bladder. In summary, the prostate is a small organ surrounding the urinary channel that plays a role in fertility. Conditions affecting the prostate can cause urinary symptoms. However, prostate cancer is usually detected before any symptoms appear. The prostate is best evaluated by digital rectal examination, or DRE, and the PSA blood test. When these are abnormal, biopsy may be required to further assess the prostate. Prostate biopsy is a quick and safe outpatient procedure. It is the best method that doctors have to confirm or rule out prostate cancer, and hopefully it can lead to curative treatment when it does exist. Other modules are available which discuss other aspects of diagnosing prostate cancer. These include Understanding the Prostate and PSA and Understanding your Prostate Biopsy Results. Your doctor will direct you to these modules as necessary. This slide lists some of the many resources available where you can find more information about prostate cancer and biopsies. These modern references were used to assist in the development of this presentation. These references were also used, and all of these are available through your local medical library if you are interested in more detailed reading on this subject. We sincerely hope that this module has furthered your understanding of the prostate biopsy procedure. We wish you the best for the future, and thank you once again for viewing this educational program.